Good afternoon, everybody, and thanks for joining us here on KXAN Live. I'm Will Dupree, coming to you from the KXAN Live studio. We appreciate you joining us, and we're launching something new today. Each week, we're going to highlight some inspiring health journeys and share information that will hopefully help you live a little bit better and healthier and longer, we hope. And this is all as part of our Simple Health initiatives here at KXAN. This is part of our reporting that we focus on health and nutrition and financial health, all kinds of different things. And today we're extending that and we're bringing into the conversation one of our producers here at KXAN. Please welcome in Jose Torres. Jose, thank you for being here. Nice to see you.
Hey, Will, thank you so much for having me. I'm excited.
Yeah, Jose is one of my very good friends here at the station, and I'm so glad that you'll be a first-time guest on our space on here, because we're going to focus on something that's really important to you. Now, I know a lot about your journey, especially in these last few years, but talk about why 2020 was such a transformative year for you personally.
I'm diabetic, and at that time I was still diabetic. I was actually diagnosed with diabetes in early 2000. And so I was diabetic, it was the start of the pandemic, and there was a lot of isolation. And then I get hit with a stroke, and you think you're getting hit with all these potentially dark moments in your life, but it actually ended up being a good and amazing blessing for me because it changed my life for the better.
That's really amazing to hear, because I think that will be such a big obstacle for anybody to take on. But let's talk about your stroke experience. What was it that made you feel that something was off or that you were suffering from that?
So at the time I was working overnight. So it was in the middle of the day that I was sleeping, and I just remember feeling this heavy brick on my face, and it ended up being my left arm. And once I realized that it was my arm, I was trying to move it, and it felt really heavy, and I couldn't really take it out of place it out of my face. So then I started Googling. I'm like, oh, what are these symptoms? And then I started getting a little freaked out because I thought, oh my gosh, I'm having a heart attack. But then those symptoms went away within like a minute or two. Then I relaxed a little bit, and then like maybe 5 minutes later, those symptoms came back again. I had a tingling sensation on my left arm. It felt heavy. So I called 911. They sent over some medics. And during that 911 call, my speech started to slur, so I got even more nervous. So the EMS medics came within a few minutes. By then, my symptoms were gone. They evaluated me, and they said, don't go to the emergency room right now. It's the start of the pandemic. You're going to get sick. You're fine right now. But, start making appointments with your doctor to see what's going on with you. And I did. So that was like in March of 2020. And for the next 5 months, I went through several tests, exams, x-rays. And it turns out that I have a blocked artery on my right side, and it's so blocked that putting a stent there would actually make it worse and could potentially end my life. So I'm just working with the left artery.
And as you are kind of moving forward with your own health journey, you were thinking about some of the lifestyle habits that you had back then. Can you talk about how those maybe have changed since you discovered all this and went through this?
Gosh, yeah, in my teens and early 20s, let me just tell you what my menu looked like some days. It would be like a large Coke, large fries, a Big Mac, and then a 20-piece nugget set. And that was all in just one sitting. And then I could eat again 4 or 5 hours later and probably be the same meal. I was also drinking a lot and eating a lot of processed food. So all of that, didn't help with my diabetes diagnosis. And I was drinking a lot, and then it wasn't until my 30s where I started to realize I need to take care of myself. And so I started running because I thought, oh, okay, cardio will help you lose some weight. And it did. But during that process, I thought, okay, well, I'm running. I might as well do a half marathon. And I ended up doing 3 within a 6-month period. But my knees started to hurt because I didn't know anything about recovery, about mobility, nutrition, hydration. So I was putting my body through all this stress and didn't know how to recover. So then I stopped, and then I, continued with the heavy drinking and, eating some of the still eating some processed foods. And so kind of started gaining that weight back again. I think I weighed around 230. That was the most I weighed. Then in my early 40s, then I'm like, okay, this was like months before my stroke, and I realized, okay, I need to take ownership of my health. And so I hired a personal trainer, and then we started working together with running, and I learned all about proper nutrition and stretching, mobility, and I've done a full marathon, a couple of half marathons, some obstacle races, and yeah, I'm having fun now at 46.
Well, I mean, there is nobody in this building that inspires people like you do, I think, just because of how active you are and how persistent and consistent you are with those things, too. It only ripples out and affects a lot of us in this building. So I'm very excited that you're going to be joining me each week to kind of highlight a simple health conversation. So just explain maybe what you're hoping to get from these weekly segments and share with people.
Through my health and fitness journey, I've met so many awesome people who are battling cancer, who live through cardiac arrest. And again, you would think like those dark moments in your life would destroy your spirit. But through fitness, people have been able to come back stronger. And so those stories I want to share with other people, just because if you're going through something similar, doesn't mean that it's the end for you. There is hope.
And that's, of course, where we're going to come in now and share a story that you had put together and shared out there. So talk about what we're going to watch here in just a few moments.
So there's this group of older adults, and their age ranges between 70 to 100. And they're taking these foot strengthening classes 2 to 3 times a week. Because as you get older, and if you're not as mobile, your bones are not going to be as strong. So it's very important for you to walk with confidence, because a broken leg can mean you're going to be sitting or laying in bed for months, and that leads to isolation and depression. So you want to really have strong feet and walk with confidence, and this is what this group is doing.
Let's take a watch of that story that Jose helped put together, and we'll continue our conversation on the other side.
Push, pull, and close. Perfect, guys. Great job.
I'm Gail Peterson. I'm 74. My goal was to strengthen my legs and to get my stamina better.
Down to the right, up to the left. Trying to get you to twist that core.
I've been a dancer most of my life, and I've taught dancing for many years, and so I'm used to moving around and keeping myself limber. My first name is Donald, and the last name is Oliver. I'm 93.
Again, we're going to go to 20. We're really trying to push it here, guys. We're getting strong. My name is Ross. I'm one of the personal trainers here at the senior home. Bring that right knee in the air. Drop it down. Bring the left knee in the air. Beautiful. My name is Marcel Rosenberg. I'm a personal trainer and instructor here at Brooksdale. The number one death in seniors is falling. So for me, the most important thing is strengthening the legs so that they can prevent the falling from happening.
That's another thing that this class gives you is confidence. It's all about balance here. And if you can't get stronger and your legs don't get stronger, then you're not confident about walking or doing on any of those things. And falling is the number one thing that happens here.
My focus is on ankle strength, knee strength, hip strength, and then core strength so that the seniors can walk around and feel confident. Left ankle over the right knee. Let's push that knee down towards the ground. Nice, looks perfect. There you go. The biggest thing that hurts the seniors is them falling and breaking their hip or getting a bruise that basically debilitates them, and then they can't live their life.
My children, I have two, Sheila and Don, and they kind of gave me a goal to say, okay, you need to get back into shape where you really can walk better and have more stamina, and then you can go anywhere with us in the world. Kind of a good carrot, do you think?
Let's reach down towards that left leg. Really stretch out that hamstring.
There is a certain amount of elation after doing those kinds of exercises, and you feel as though you're a little more nimble and can move a little bit better.
We're going to do our last move of the workout, okay? We're going to open up those knees. You're saying, praise the Lord.
Like now the classes have gotten so easy for them, now I'm having to like throw curveballs so that we can challenge them a little bit more.
And then when they feel like they can stretch you, they do.
And you do it gracefully? You do it with a smile?
Well, sometimes I have I'm going to give them a wisecrack back, but yes, it's good for you.
They always raise the eyebrow to me. Always. But they love it. They love a good challenge.
They definitely catch on. I'm the guy who just like, oh, yeah, a couple more seconds, and then we'll go for like another minute, but I know that they're capable, and I'm the coach that's supposed to push. Now we're going to kick up and down from the hip. 10, 9, 8. I actually don't have any more grandparents, so this is a way that I can connect with that community, and it's just so fulfilling. It's very, very rewarding. 2 thumbs up. Nice.
For somebody at home who's watching this and, doesn't feel like moving around, what would you tell them?
Get up. Don't sit in the chair. Get up and move.
A simple message there to kind of end everything. But I'm hoping that, if people see that, this at least gives them some ideas about maybe things to try out at home or share ideas with people that they might know to give them some additional strength and stability.
And the gentleman, Donald Oliver, he's 93 years old, and you probably can't tell, but he lost his vision, and he's still in high spirits. He looks forward to that class, and I like his message, just move. And I think we overcomplicate health and fitness, and it really is simple. It's just movement, and that's really all it is.
And these are just some of the stories that we're hoping to highlight in this live stream space and give some conversation to this. And if anybody out there has questions or things that you maybe think we should look into more, please let us know about it. Leave it in the comment section if you're watching us on Facebook, or send us a message on social media. Our social media handles are just down here below us. But Jose, I think this is a great place to start these conversations. That was such a fun story, and I'm looking forward to seeing what maybe comes next from you.
Yeah, I just interviewed a young athlete who lived through cardiac arrest while he was running.
Wow.
He one of his friends saved his life, thankfully through CPR. There was also an off-duty firefighter who just happened to be there and, helped give him CPR, because, if while you're giving CPR and you're waiting for first responders to arrive, that could be like the longest minutes of your life. So they never got his name, and so this young athlete is looking for this firefighter who helped save his life. And you have to stay tuned for that story so you can see it.
That is a good tease. And if anybody was wondering, Jose is one of the producers here at KXAN. Can you share a little bit about your responsibilities? I know what you do, but for everybody at home, talk about what your day looks like usually here at KXAN.
Yeah, I come in the afternoon to get the 10 o'clock news ready for those evening viewers.
Yeah, so everybody who's watching the 10 o'clock show, this is the man who writes so much of it, puts it all together, and makes sure that it all looks great so that you all can enjoy our newscast coming up at 10 p.m. tonight. But we'll leave our conversation there, and I'll let you know, everybody, that we'll be back next Wednesday afternoon for another conversation focused on simple health. Jose, thank you again for joining us.
Yeah, thank you, Will.
Everybody, that is Jose Torres. I'm Will Dupree. We will see you back here at another time. Hope you all enjoy the rest of your day. Take care.